Hey, how's it going, guys? Sully from Glory Days Magazine. I'm here with Dr. Brian Sokolsky of Jersey Shore Sports Medicine in Somers Point. Part of our ongoing video series of some businesses that are supporting us and helping us bring you the great stuff we do on a daily basis with Glory Days Magazine. I want to talk real quick with Dr. Sokolsky. I know it's kind of the middle of swimming season, and a lot of student athletes in the swim teams, that's a lot of repetitive movement every day on your shoulders. I'm sure you see a lot of that with the shoulder injuries, the rotator cuff, that kind of thing. So talk briefly about if a swimmer's having some trouble now in the middle of the season, what can they do? Should they come see you if they're feeling some pain? How do they know the difference between just everyday pain and grind of the season as opposed to, hey, maybe I have an injury?
Well, that's actually the biggest challenge, is knowing the difference between muscle soreness and pain. And the best way I describe it is if it's just kind of achy and you can work through it,
right,
and it stays the same or even gets better during a workout, that's more soreness. Whereas if it becomes more of a sharp pain and limits your workout, that's more of an injury that needs to be looked at. The sooner the athlete gets looked at, the quicker we can fix it, and the easier it is to keep them swimming. Whereas the longer they try to hide it or fight through it, they tend to have to take more time off.
Now, do you see at this point of the season, we're about halfway through, they still have about 6 weeks to go. The better teams will go advance on to March, so you're talking about 5 to 6 weeks left of the season. Do you see kids at this point of the season really struggling with some shoulder stuff in terms of the swimming, or do they kind of try to grind through the season and then come see you after the season?
A little bit of both. I mean, usually for the overuse stuff, we tend to see it more at the beginning of the year when they haven't done much off-season conditioning. This time of year, they tend to do well. However, as they start getting into playoffs, get into more of the end of the season competitions where they're upping their distances, they tend to get more injuries. So I do tend to see them towards the end of the year.
We're here with Brian Sokolsky. He's a doctor of sports medicine in Somers Point. Real quick before we end this segment, Doc, what can student athletes who are swimmers do to kind of make it through the season and get rid of some of that soreness that you feel halfway through the season? What kind of things should they be looking at to try to stay healthy in the next 5 to 6 weeks?
Sure, they can put together just a quick out-of-water shoulder workout where they're focusing on the rotator cuff and muscles of the upper back that stabilize the shoulder blade. So a quick 5-minute, a couple times a week to keep that the shoulder and the rotator cuff strong can help offset some of those overuse injuries.
Cool, that's just a couple good tips for some swimmers out there. If you want to follow Dr. Sokolsky on Twitter, it's Jersey Shore SM. So we'll try to get him to post some more stuff, some tips for swimmers, baseball players, all that kind of stuff. Spring sports are going to be here in just a few weeks. So follow him on Twitter, Jersey Shore SM, and we'll get you some good information.